And where are you from?
Hi, listeners, and welcome to I Never Knew, But My Dog Did podcast. I am Maureen Scanlon, a master life coach, and I help you recognize and elevate your self worth for your most desired life. Guys, I cannot tell you how excited I am about today's guest. And you know, if you've listened to my previous 192 episodes, that I always say there are no coincidences, and the people who need to be in our circle, in our lives, and in our presence will show up. And she showed up. And it was so cool because, as you all know, from my last week's coming up episode, where I tell you everything about my medical journey that I had been through in the last 6 months. Um, it was a lot. It was a lot. And so I was really excited to find a guest who, can really understand that and help others understand that. And we can all kind of be in this thing together where we share and help one another. So I'm just so happy that all of you are here. I just really, really am. And I want to tell you about today's guest. Her name is Dana Sherwin. She's a consultant, speaker, writer in the field of healthcare management and patient engagement. She founded the Thinking Patient LLC in 2023 to offer consulting and training resources related to empowering patient engagement and strengthening patient physician communication. She has served in healthcare executive and consultant positions throughout her 35-year career. Oh, I love that. I love that. When you're in your passion in your place, when you're 35 years, you just don't want to stop. In prior roles, Dana has worked in hospitals, managed care plans, and three of the largest accounting management consulting firms in the USA. She holds a Master of Health Services Administration degree from the University of Michigan School of Public Health and a Bachelor's of Science degree from Cornell University. She is a fellow in the American College of Healthcare Executives. Dana serves as a volunteer advisor with the Blood and Marrow Transplant Clinical Trials Network, a member of the 2025 editorial review board of the Journal of Patient Experience. Ooh, that's something I would love to see and read. And she is also a peer reviewer for the Journal of Healthcare Management. Oh my gosh, I just had to read all of it because it's all so, so impressive. And now we get to hear also the personal side on the other side of the professional part. So, good morning and welcome, Dana, to I Never Knew. I'm so thrilled, as I said off air, to have you here and to learn from you, really.
Thank you so much, Maureen. It's my pleasure to be here. I'm excited about our conversation. I love speaking with people who have have seen what it means to be engaged in your care and have gone through some things and are excited to share that with others because it's something that seems to be sort of a little known knowledge and skills out there, and nobody goes to a bookstore to buy a book on this subject. So it's a lot of experience and research and really just general interest to want to make one's life better and make the life of family and friends better as well
Oh
related to
my,
healthcare.
I so agree. And I think you're so modest. You're downplaying how important this niche is because there's nobody else out there telling us these things. And when you are in these health crises, as I just recently was, you feel so helpless. I was so helpless. I'm a master life coach. I help people find hope and move forward and meet goals. And I was literally at the point where it's like, I don't want to live. I don't want to live if this is what I have to go through. And mine was chronic pain, and I ended up having, incidentally, finding thyroid cancer from having an MRI because of neck pain. And then I ended up having two cervical spine surgeries so three surgeries within 3 months. So it was a lot. And then I had complications from that, and I'm still going through it. But the helplessness that I felt and being in the professional world in the medical field, just like you, I thought, I got this. I got this. But when you're on the other side as the patient, you just feel like you don't know anything. All of a sudden, all the knowledge that you had as a professional goes out the door. So, what we do here on Inc. is we always start off with your knee story. So, that's that moment. And boy, did I feel a knee story with this last few months. It's where you're just kind of on your knees feeling like, I just don't know what to do anymore. I'm helpless. I'm hopeless. What can I do? What can change? Help me. I want to know, and I want the listeners to know where your passion comes from your own personal story. So share your knee story with us.
Okay, I'm probably going to start a little bit backwards because I was diagnosed about 20 years ago with an incurable blood cancer. It was genetic but not inherited, meaning after you're born, your genes change, they mutate, and there are many different diseases that could happen that are genetic versus inherited. And it was discovered because I had a pain in my stomach. At first, I thought it was stress because my mother had just passed away, and I had a year of living with her in my home, and she passed from metastatic breast cancer. So it was very stressful in my home. I had small children. I developed this pain in my stomach, and I was having a routine visit with a gynecologist who said, well, you shouldn't wait with this pain. I don't know what to tell you. Why don't you see a gastroenterologist? So I went to see a gastroenterologist, and God bless this doctor who took the necessary tests and sent me for an ultrasound. And the look in the technician's eye was so scary. He said, just wait a minute, I have to bring in the doctor. They discovered a blood clot in the portal vein of my liver. And they said, we need to send you for a CAT scan like immediately to see what it is. I said, is it an emergency? He said, well, we need you to go right away. So they got me an appointment. I went in my car driving home. The gastroenterologist called me and asked me if I had a hematologist. And I said, why would I have a hematologist? And he goes, well, I have one to recommend, but I need you to go straight to the emergency room. So I had this blood clot that I would feel off and on. That was the pain that I was feeling maybe for about 2 to 3 months. Went to the emergency room, and then through, diagnostic workup and meeting with who would then be my hematologist for about 5 years or so, they found that my underlying condition was a blood cancer disorder. And so, because I was able to sort of live my life just being monitored, I was able to live sort of a normal life, but I had a lot of symptoms. And I went through my life basically ignoring some symptoms because I was being monitored pretty closely. And it got to a point where um, the doctor I was seeing in near where I lived said you need to go into the city to go to one of the major academic medical centers because that's where they have the clinical trial. Because for your disease, there's no cure, and the disease went from having too much blood in your system to having too little blood in your system, where the bone marrow basically dries up. And so I switched doctors and hospitals, and I was on a number of different clinical trials, but it really got to a point where the only cure was a stem cell transplant. And back the 20 years ago, when I knew I had this condition, there were the statistics weren't good on survival. So I really held off on a stem cell transplant until really I had no choice. And so it's really only 6 years ago, 6 long years ago, 6 short years ago, that I had my stem cell transplant. I was very fortunate. They found an unrelated donor. I didn't have anybody related to me who could donate blood. So I had an unrelated donor, part of it's an international bone marrow data bank, and I successfully went through that procedure and had a long recovery, years long recovery. And about 2 years ago, I started to like come back to myself because my main goal during post transplant 6 years ago, my main goal was to take care of my health, do my own care management, and focus on my recovery and not like think about anything else. In fact, this whole long career I had, which I loved, I had to stop suddenly because my health crashed. And so I didn't even get to think about sort of the PTSD that would happen related to not being able to work and do the work that I loved. And during the recovery period, only like 8 months after my transplant, COVID happened. So I was locked out of services from, physicians weren't really seeing people on an outpatient basis for a good like 4 or 5 months. And sort of the world stopped. And it was very scary because I was still like sort of in my first year of recovery. But, I made it through. I was able to get back after like 5 months and go see doctors again. And I went through a number of hospitalizations. The recovery was rocky. But again, after about 2 years ago, I started thinking about like, I'm feeling better. And yeah, I can't go back to the kind of work that I used to do. What can I do now? What have I learned? And my hematologist oncologist, who was responsible for my transplant, actually sparked this in me. She said to me at one visit, you're such a good patient, Dana. And I said, well, what does that mean? It means my health, I'm doing well, like I'm progressing. She goes, oh, no, I don't mean that. I mean, you ask good questions. You're always prepared for every visit. You follow up on things that we forgot about. So we could always rely on you to follow up on things we forget about. And I said, well, doesn't everybody do that? And she said, no. So it was like a surprise to me because we all think that what we're going through, oh, everybody goes through, everybody views life through the same lens. And, I had my lenses on, my own personal lenses on, and I didn't realize, well, maybe I know things just because of the work that I used to do and the healthcare systems that I navigated and tried to make better. And maybe there's something I learned through my own experience with this very complex disease and having to go through all of this. So she sparked that interest in me. Well, maybe I should study how do doctors communicate with patients and what do patients need to know about that process? And I started on this journey and every day I'd wake up with this is the work that I did. I did research, I did writing, I tried to put together sort of new, sort of consumer friendly approaches to how people could engage in their care, ask better questions. What was there that was out there? And I did find that there was a lot out there. And that's now the past few years of what I've been spending my time on, helping organizations, helping people to be better patients in a way, to be more engaged in their care, to not be afraid. Look, nobody likes seeing doctors. And that was the premise. No one likes seeing doctors. We all have that in common, but we're all patients, whether we see doctors once a year or once a month. We're ultimately responsible for our own care.
Oh, I know you're in front of me for a reason, and my listeners, my faithful listeners, you guys all know that I always say whatever experience we asked for, it's because we wanted to learn something. And when you said, "What have I learned from this?" I did the same thing as I was going through it and miserable. And I now I'm not a Pollyanna like, "Oh, you'll get through it. You'll teach everybody something later." No. What I've learned to say is this sucks. This sucks as I'm going through it. But I also, in those moments, said, there's going to be a pay it forward. There's going to be a reason why you're strong enough to go through this because you're going to help people later. And I love that you said, what did I learn? And researching and learning, there is such a deficit in being able to advocate for ourselves. And I think the medical finally field is sort of changing where we're allowed to do that. Because I feel like growing up as a Gen Xer, like we were just told, here, this is what you're doing, this is what you're taking for medication, this is the normal of what we do. What I experienced through what I had gone through with my surgeries, I literally went to a surgeon who is renowned both nationwide and here in Austin, Texas. And every time something would happen, he'd go, I've never seen this before. Now, this man has done thousands of surgeries, and I think he said it 4 times, and it became a running joke in my family. Like, every time he'd say it, we'd look at each other and start laughing because there was nothing normal about what I went through. That I think is for me the foundation for advocating for ourselves is stop allowing doctors to say, well, normally this is what happens, or standard care, standard operating procedure, or standard of care is this. Do you agree with me on that, Dana?
Oh, absolutely. I also think that people confuse the word, you have to advocate for yourself. It's such a, in a way, it's a negative process, a negative thought. I think it's self-advocacy is about doing what's right for you. It's not in contention because you have no idea, whether the personality of the doctor or how the doctor works or what the doctor's strategies are or how the doctor's going to relate to you. The self-advocacy is basically being able to have your own voice and asking the questions that pertain to you, and by having your voice to be able to tell your story in a way that is sort of concise but compelling and really wanting to get the root of what's going on and how you can be a partner in your care. So I always try to clarify what advocacy means. Yes, there are times when you have to actually fight for what you need, but self-advocacy, we can't make it such a negative connotation. Self-advocacy is important. We can't expect physicians or the healthcare system to be able to know every single individual. We have to have the agency to be able to be out there and represent ourselves.
Right, right. And I know as much as the medical community hates Dr. Google, let me tell you, I had to learn a lot from
Mhm.
Dr. Google, and actually was effective because I could go in there and ask the questions and say, well, I had read about this or I had heard about this. Especially when you don't know anything about what you're going through because you've never gone through it, and especially when it's a surgery or a significant illness. I mean, it's interesting how that can be a negative. Doctors don't want you to look for, research other things. Also, I did something different, Dana, that I had never done before. I got a second opinion. And it's very unlike
Mhm.
me to doubt a physician or a surgeon. Well, I went to a surgeon who was very negative and basically said, I can't help you. And I'm at a pain level of an 11 every single day, and I cannot exist. I can't do anything in my normal life. And he said, well, nobody can fix your neck, Maureen. I mean, a surgeon will take your money, but there's nothing they can do for you. And I was devastated, walked out of there in just tears. And I went home and said, I can't do this. I don't want to live like this. I can't live like this. And my husband said, we're going to get a second opinion, and then we're going to get a third and a fourth. I've never done that. How important do you think it is for us to start looking, being the advocacy part of this is keep looking for that professional, that doctor who's going to help you, who's compassionate about wanting to help you. What do you think?
Absolutely. I've actually written a couple of sort of blogs on second opinions because people are not comfortable with it because if they have a relationship with their doctor, they don't want to insult the doctor. But if your doctor is really good and is a no, he'll work with what or he or she will work with whatever doctor that you go to. So yeah, so on LinkedIn, I write about the subject in quite a lot of detail because I'm trying to encourage people to identify those times when it's really important to get a second opinion. And insurance companies, they're very supportive of it. Most policies included, they encourage you because they won't run off and have a surgery or have a treatment that's going to be so expensive without really having like a process that goes into making that identification that treatment is the right treatment for you. So I stand behind that. I've had my own second opinions for myself, for my children, and I do think it's a, very big component of being able to, communicate, and in the process you learn so much more because every doctor is a little bit of a nuance difference. I do talk about like how you find a second opinion. So it may not really be a second opinion if you ask your own doctor for a recommendation. If you're in like a group practice, you wouldn't necessarily want a second opinion from another doctor in that particular group practice. You have to go outside of it. Also, if there's any comorbidities or nuances to your condition, you might want to have a second opinion of, let's say, an orthopedic surgeon who's also dealt with a lot of oncology patients. And so you might want to get a second opinion with a little bit more of a specialty attached to that. And like it's really a, to know those things that you have access to, particularly, people who have, insurance policies and because it's the right process to go through to figure out what's right for you.
Oh, I love everything that you just said. And that's our first takeaway, listeners, is look at your insurance policy, call the insurance company and say, hey, I'm not comfortable with this doctor. I don't feel like they have my best interest. I don't feel they understand my health issues. I need to go to this other one. I was blessed. I have, and I'm going to do a little shout out to Blue Cross Blue Shield here. Oh my gosh. I don't even know what I would have done without them being so open to me being allowed to go to this doctor, go to this doctor. And I have doctors now in all different groups, even though my PCP is in one group. And you're right, that's the first orthopedic surgeon who was terrible was in that group. And I had to go outside of that group and literally found him on the internet. And there were like wonderful testimonials. And I thought, that's my guy. And he was 45 minutes away. So that was a lot of traveling and headache. But man, I love that you say that. We have to, because our policies, we don't really look at our policies until we need them. You ever notice that? And then you're like, oh no, it's not covered. My husband just had oral surgery. We show up, literally Monday he had it, and to put a post in for a transplant. We show up, and my husband, I was in the medical field in the billing and coding, so I know do not pay a bill. I tell him all the time, do not pay a bill. It has to go through our insurance first. We show up, they're like, that'll be $3,000. And he looks at me, and I'm like, you didn't even like let me know, so I could have called ahead of time and researched it. So that's a crucial thing, listeners. I believe is, look into some of your benefits prior to needing them, especially oncology, right, Dana? Don't you agree?
Oh, yes. In fact, you raised the point of if you were fortunate enough to have insurance and good insurance, then it really is to your advantage to understand some fundamental things about taking care of your health. And one is finding a primary doctor who you're aligned with, who you have a connection with, who you have good communication with, and see that doctor once a year. This is something I did not do until, my 30s, early 40s. It took me so long to figure out. It took me having this disease for a doctor to say to me, you will need help in coordinating your care. You should have somebody who's looking at your overall you and your overall health. So my first point, if you have good insurance, if you don't also, I mean, having a primary care doctor to help you navigate complex things and coordinate with other doctors is absolutely essential. That's number one. Number two, really get comfortable with whether it's, a specialty group that's either affiliated with a major medical center or a large hospital system to get familiar with the routine things that people usually need. That is, dermatology, perhaps allergy, cardiac for people. What's really come out for me, I never had any cardiac issues before I got sick, and once you have the transplant, all these other effects happen. But what I'm finding of people in my age group, and particularly men, they don't go to a cardiologist until it's absolutely necessary somebody hears something wrong. People should see cardiologists, and it's not for me to say I don't give medical advice, but starting when you're either in your late 30s or early 40s, everybody should see a cardiologist to get a baseline, to do that check and let that cardiologist tell you where you stand on all your, cardiac markers, your history, your family history. And so that's really important too. My kids had all different kinds of issues that I had to search for these specialists. I mean, knowing who your specialists are, which ones you need to see on a periodic basis, and which ones you need to have in the hopper as you need them. So it's all part of like really your preventive health and health promotion to have all these things available to you. The other thing about having insurance, a lot of insurance plans now offer, nutrition counseling. Or if you have certain orthopedic issues, they offer rehab, outpatient rehab. They offer mental health services. So, like you said, most people who walk around healthy don't even think about, let me learn about other things to take care of my health. This is part of like my message as well. There are things that we can do for ourselves, for our family, before it turns into a crisis, before it ends up in an emergency room visit, before it ends up with you have to go to urgent services, before it's an opportunity is missed to identify a diagnosis before it becomes worse, like a type 2 diabetes. Very important. A lot of people, don't have their glucose levels checked, so they don't know where they stand. And this is just so many opportunities to nip these diseases at the beginning and not have to wait until you're in a crisis mode.
Oh, amazing. I shake my head because I'm just like, oh my gosh, you are so right. And medical professionals, I'm talking to you because I was the most stubborn, I don't need to go to the doctor person my entire life. I literally went 4 years without a PAP and I ended up with cervical cancer. So I'm talking to you medical
Mhm.
professionals. Please, this is not a mechanic's car is always broken. You need to do exactly what Dana just said. Also, the catching it early. So I come from a family, my father did not go to the doctor for 50 years and he ended up with colon cancer with a tumor the size of an orange. That taught me. And then on the other side of the spectrum, I have a husband who goes in for everything. And I used to be like, geez, are you going to the doctor again? But now, that was my lesson was like, turn that around,
Mhm.
Marie. No judging. Now it's like, oh, good. I finding incidentally the nodules. I had four nodules, one of them being cancer, the bigger one. Um, I told my husband the next time you go in for your checkup, go ask for an ultrasound for of your thyroid. And this is something women, I'm going to speak this to you. The percentage of women with thyroid disease that is undetected is huge, at least 50%, because a lot of them don't give you any symptoms. I had no symptoms, and here I had all of that stuff going on. So, what I learned was the requesting of testing. Usually, we're like, oh, okay, the doctor wants to send me for this. I learned, told my husband, go in and ask for an ultrasound of your thyroid. He does have a couple, but they're not concerning, and that's fantastic. But you're right, advocating that yearly to get those markers, especially lab work. So let's talk for a moment. God, I could talk to you forever. Let's talk for a moment about medical gaslighting. So I have extreme
Mhm.
PTSD because every time I went in for something, they found something. And like you said, you start with one thing and then it starts sort of piggybacking it. I went in for neck pain for an MRI. I end up with thyroid surgery, losing my voice for 8 weeks, which is why I couldn't do my podcast or my coaching. But I ended up in a rehab after my second cervical surgery. And that physician that was in charge of the whole rehab center, every time I would say I'm having pain or my blood pressure feels really high or my head doesn't feel right, he'd say, you've got a lot of anxiety, and he'd throw me an Ativan. He had me on, round the clock oxys. He had me on so much stuff that I literally went into the emergency room a week ago and the ER doctor was like, "What? You were on all of this?" Because I was having withdrawals of all things gabapentin, not an opioid. I had no idea I could have that. He gaslighted me in that facility and I didn't realize it till I was out because I was kind of doped up and, kind of in pain and
Mhm.
wanting to sleep. How do we fight the medical gaslighting and fight for ourselves? When I went in after my first surgery of my neck, I went into my doctor, my surgeon, and I said, I'm having pain. Well, yeah, you just had surgery, Maureen. I go, no, 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 no. This is not the same pain. This is different pain. I promise you, I know my body. I know surgical pain and I know pre-surgery pain. I have pre-surgery pain. He ended up sending me for an MRI and I had a hematoma from the surgery and we had to go back and he said, "Can you come in tomorrow for surgery?" And I was like, my family's out of town. I literally ended up going back in 4 days later for my second neck surgery, which is pretty dangerous to have all of that trauma between the thyroid surgery and two neck surgeries all within a period of time. So I loved my surgeon, but I still received a little bit of that gaslighting of, I don't quite believe you. You're gonna have pain. Suck it up, buttercup. How do we deal with that gaslighting? How do we convince our providers we know our bodies?
Right. Um, So it's a difficult question, and there are a lot of um, people out there who actually have written books on medical gaslighting because it's a really like current, visceral issue right now. What I would say is that when you know yourself and you know your story, you have to, in a way, be as calm as possible and as confident as possible to express yourself to that doctor. If you feel the doctor's not listening to you, then you could try to bring in a friend or family member and have that conversation again. Or if you can, sometimes you're in the middle, you can't switch doctors because you're in the middle of something that's going on. But you have to do the best you can to say, I know myself and express yourself. And look, the information that the doctor is not really getting you is important information. So you know that for next time. But I think you have to continue to assert yourself in a very calm, confident way. It's not always easy because number one, pain is hard, being sick is hard. There is a lot of anxiety. Um, and you could not be an anxious person, but still have anxiety because it's situational. It's related to you're really scared of losing your life. You're scared of being in pain for you can't imagine. I had a headache for 9 months post my recovery. It was all drug related. They weren't figuring out, well, they took me off the steroids, so the drugs that were left were causing these headaches. I for 9 months, my primary care doctor sent me to six different specialists, get a head MRI, have ENT. He says, we'll take it step by step to find out why you were getting headaches until it was a pulmonologist who said to me, well, you just got off the steroid, and sometimes this drug that you're taking for graft versus host disease then causes that pain. So they lowered the dose of the graft versus host disease drug, and it was like within a day, my headache went away. For 9 months, I had headaches. But you have to, again, you have to be the one expressing yourself and fighting for an answer. Unfortunately for me, it took 9 months to get the doctors all talking about what this could be, because they weren't finding anything else. And it ended up being drug related. Maybe I got migraines. It was all these like speculation of what else it could be, and it was all drug interaction related. And so, knowing how to raise questions, knowing how to express yourself in a calm, focused way, having a family member or a friend, or if you can, to switch doctors or ask the doctor, what else can it be? What else could it be? And try to get the doctor's attention. But I would say generally that, other people have written books on this issue because there's just so much of it going on right now. And people need to know, and it's going on a lot for women, and people need to know how best to deal with it. So it is a very, very important question.
Yeah, I
Um,
just I wrote down
mhm.
I'm gonna read a book on it because I think it is so crucial. And again, when you end up with an illness or an injury, that's not the time to learn about medical gaslighting. Like learn about it prior to and how to really speak up. And speaking of speak up, I'm here in Austin, Texas, and the biggest medical group here in Austin, Texas is Baylor Scott and White. They have a policy called Speak Up. And it means you're allowed to ask your doctor for a procedure or say, no, I don't want to do that test. Or, hey, what about this? It is fantastic. And I wish the whole rest of the
Great.
country would do that. I've never experienced that. I grew up in Arizona, only been in Texas for going on 3 years. When I saw that they have a little poster in the office about the Speak Up, I was just my jaw dropped. I thought, that's
Wonderful.
it. This is what Dana's talking about. If we could like get this movement going with the rest of the medical community, and nobody's offended. My PCP is never offended. I had a video conference or a video appointment with him, and I love this, Dana. You're gonna love this. At the end of it, he goes, "What do you want, Maureen? What kind of tests do you want me to run?" Now he knew I worked for a laboratory and I, had a medical background, but still, he would do this with anyone. But I thought it was the coolest thing when he said, what do you want me to run? And I was like, well, let's do a CMP. Let's do, let's do my TSH again. I need to see, make sure my other thyroid now is where it's so fantastic. So that's a big part, right? Don't you think that we should be able to ask for the test that we want? Because get educated on the testing, get educated on the medication. Like you said, I didn't know gabapentin gave me withdrawals. I'm now having to wean myself off of gabapentin of all things, which is an anticonvulsive because I had nerve damage on the left side. And I love that you bring up that point where it was all medication related and it took just random every now and then. I've had an ultrasound tech mention something that I was like, oh wow, really? Maybe I should like ask my doctor about that. Like it can come from the most random place back to we're not standard. We all have different bodies, different chemistry, different genetics, all of that. We have to make sure these doctors and medical professionals know there's no norm, right? Don't you agree with that?
Absolutely. And I know you brought up before in terms of Dr. Google, and I've written about Dr. Google too, because I do think it's important to do it, but not to overwhelm yourself and not to overwhelm the doctor, but there's a way to do it. But attached to really Google, and Google has AI also, but there are wonderful AI programs right now that anyone can use for free. And you can put in there, I'm seeing a gastroenterologist for the first time. I'm X number years old. What questions should I be asking the gastroenterologist? What kinds of tests should I expect? How to keep my gastrointestinal health? And just for you to get the background and to develop questions so when you go see a new doctor, either you're having a problem or you're not having a problem. It's for a preventative or it's for something that you're experiencing. You run that through an AI program, it will give you sort of the consumer ready knowledge to be able to form your questions, to be able to figure out what's related to you, what's specific to you, what do you care about the most, and relating it, you relating it to your own family history, things you're worried about, or things you want to know more about, or what other things in your sort of holistic, all the other things that are happening to you for your health, how does it relate? How does it relate? And so, these are tools that people and resources that people could get without listening to me talk about like what are the 5 parts for you to set up a process to prepare for your doctor's appointment. This is something everybody can do. And I do it also because it has taught me that I want to be prepared for every appointment that I have with every doctor. I want to be able to form my questions. I want to set my priorities. I want to share any research that I've done. I want to have follow-up questions on other tests that I've had, that other tests that other doctors have had. Every time I go to a different doctor, I will tell them like what happened to me since I saw them last in terms of, look, I just want to let you know the cardiologist said this and gave me this new medication. I had a colonoscopy and that's what they found. And I actually keep everything in one notebook. I created my own thinking patient planner as an outgrowth of having a very organized kind of notebook to use, but you don't need a specific format. You could use whatever you're comfortable using, any kind of notebook, as long as you have this sort of structure every time you see a doctor and you keep it all in one place. So as you go from doctor to doctor, you could just turn back and say, oh, well, I've met with these 3 doctors and this is what I'm following up on. I just wanted you to know about other things that are happening, with my health.
Love that so much. I had to giggle because now that I was seeing all these different specialists, I talked to my mom on the phone and she goes, you need to make a list. She goes, every time I go into my doctor, he goes, okay, what's next on the list? And I'm like, wow, mom, that's fantastic that you cover all of those things because you always think about before you go, oh, I should ask the doctor this, and then you forget by the time you get in there because they kind of direct you in the way they're going. What is your best advice for
Mhm.
like, here's a good example. I am going to see a neurologist because they did a brain MRI and there's some unspecified white matter, which that sounds really weird. They, my my surgeon did it because they weren't sure if I had a stroke. Because when you have neck surgery, cervical surgery, you pull your carotid artery over for them to do it. Now I had this twice in a row, so they think I may have had a stroke. What are some of the questions? Because I have weakness on the left side, I have numbness in my hand and my foot. What going to a specialist, addressing something that we have, and it doesn't have to be specific to my problems, but what would you tell me to ask when I go in there? What are the main things that we should cover? And it can be just general, go in and tell them your background or whatever. What would you tell me?
Well, so I started that discussion about how you prepare for appointments, but it's important to have your medical history summarized in a concise way. If your doctor is part of the system that uses the same electronic health record system, then it should be all in the system. Then you'd want to bring the doctor's attention to certain particular things. If the doctor's out of that health electronic medical system, you might want to bring the reports or the discs that have previous reports or tests, procedures that have been done already and bring it with you. Or even, I think my best advice, you can't always do it, is to send it to the doctor's office in advance. Sometimes doctors have time to prepare for each appointment and sometimes they don't. I don't really haven't quite figured that out yet, but I just make sure I bring it with me. But if you can bring it, send it. If it's a really complex thing, you want to send it to them in advance so they have it in advance of your appointment. And maybe they won't be looking it over, but maybe they have a medical resident or a fellow that works with them in the office, and they will definitely be looking at that, all of that, because it's their job to bring to the doctor's attention what stands out about that patient. So I think that's important. Again, if you don't have questions, readily at your disposal to do that kind of research, whether it's Googling or it's AI, and it really doesn't take very long to do. And it's also, we're not clinicians, we're not doctors. Yeah, we didn't go to medical school, but we can raise the issues to have us be better informed. Um, I would say that, if there's something, you should just keep track of what the doctor has been telling you so that you can then ask the doctor, okay, well, you said you were going to do a biopsy of this last time we met, but you wanted to wait 3 months. Okay, can we schedule this? So you have to have that note. You have to have that note, recorded so you can refer to it and you can remember. And you mentioned, forgetting to ask questions. There is sort of a term of art in the medical field. It's called hand on the doorknob questions. And you can figure out what that means. It means the doctors are leaving the room, hand on the doorknob, and oh, doctor, one more question. Oh, doctor, they do not like that at all. This is not like a good way to do business. Better to say to the doctor, I want to let you know that I want to work in partnership with you. And to the best of my ability, I'm going to try to understand, what you're explaining. If I don't understand something, I might ask you for additional resources. Like people in the community, when I do presentations, they will say, I tried to ask the doctor, but I couldn't understand it. And so I came up with 14 different ways to ask a doctor to explain it in a different way. Oh, doctor, could you break it down for me in more of a step-by-step process? If you have the language to express, doctor, can you just simplify that for me? Or can you like go back to the beginning and explain that to me? Like there are many ways that you could ask, like if you don't understand, look, not just saying, I didn't understand what you told me. I
Yeah.
mean, giving the doctor a little bit more, okay, I'm a visual learner. I like to read. I like to read something. Can you direct me to an internet resource or a website that could explain this to me in more detail? Do you have any pamphlets on the issue? So you have to know yourself what kind of learner you are to be able to respond if you don't understand something. And then as far as like you come in with a whole list of questions and questions that you really want answered. And you say, look, I want to work with you, but I have a long list of questions. I know we only have 15, 20 minutes for this appointment, but how can I communicate with you in between appointments? And doctors will tell you whether they're comfortable you connecting with them through the portal, whether you should call the office, they'll call you back, whether they have their own work email that you could send it to, or in my case, I was just so fortunate. My hematologist oncologist gave me her cell phone number. She just texted me anytime you have an issue. Even text, I was getting like terrible rashes from some of the medications post my transplant. Take a picture of the rash and send it to me. And then she will like then look at it. But I felt like what a amazing comfort level. And she would say, well, I'm going on vacation. I said, okay, well, I don't want to bother you on your vacation. She goes, no, it's okay. You can text me if something goes wrong. Like she was just, it's part of that specialty that they're seeing patients through a very, very tough time. And they want to make sure that the patient, doesn't get worse or is comforted because there's a very big psychological component to being a post-transplant patient or even being a surgical patient, like in your case. There's such uh, post stress and related to an aftermath of going through something. And you may not feel really all better for a very long time, and for me, it took years really for me to feel better. So I know what that's like. And it's something you have to figure out. What are your techniques for dealing with this kind of stress? But what I say and what I've learned from all my research and my own experience is when you have a method, when you have a pathway, when you know that there are things that you can be doing, it helps relieve the stress. So yeah, you're still going to have stress, but it's not as bad because you have a pathway. Okay, I'm having the keeping close tracks of your doctor's appointments and making follow-up appointments and doctors knowing that you're on top of things so they know you really care about your own health and you're not just putting the whole burden on the healthcare system, that you're doing what you need to do to take care of yourself. I mean, I used to be on 20 medications. Now I'm on 15 different medications. Well, who's responsible for making sure, I'm compliant? It's me. It's me caring and knowing. And I always say also, because medication management is such an important part
Mm.
of, many treatment plans and many diseases, and making sure you know how to pronounce the names of your medications, what they're for, whether you need to refrigerate them, whether you need to take them with food, whether the pharmacy gives you the right dosage. I mean, I'm
Yeah.
constantly, even after all these years, the pharmacy, I'll look at the bottle and go, does that look like a 90-day supply? I want to make sure that that's the right one. Or they changed the shape of this tablet. How come? Well, and it's just sort of like wanting everything to go right. And I don't even call it neurotic because I was never really a neurotic person about it, getting everything so perfect. But knowing when you take the wrong medication, it could screw up your process, your whole progress. You don't want to be in that. If you have control, putting the things in your control that you can control, and that you could feel makes you feel better, gives you more, confidence and courage to keep, moving forward and doing everything you can to take care of yourself without overwhelming yourself and making sure sort of you're, working in partnership with your doctors. My experience has been when doctors know that you are prepared, organized, have questions, and want to do the best for your health, they really enthusiastically respond to you. And if they don't,
Yep.
then it's not the right doctor for you.
Right, right. Oh my gosh, I agree so much with all of it that we have an accountability in our own health. We can't just rely on, oh, the doctor didn't follow up with me. I love that you said, oh, you said you were going to do this in 3 months. Are we going to do that now? They have hundreds of patients. They cannot remember everything about you. You have to remember everything about you because that's all you have to worry about. I love the medication part of it because I don't count on the pharmacy, don't count on the doctor to tell you all of this. Again, had I known you could withdraw from gabapentin, I would have definitely had them lower the dose or take me off before I was on it for now 6 months. But the other thing is I was put on blood pressure medication in the rehab center. I was in there for 2 weeks and then abruptly taken off. And there's a thing
Mm.
that, yeah, you cannot go on blood pressure medicine and then be abruptly taken off. I now have high blood pressure because there's a thing that is actually caused by being put on high blood
Wow.
pressure medication. Well, interestingly enough, and again, my doctor's very thorough and I love him, but I am big on using NSAIDs because I have autoimmune and a lot of inflammation, a lot of neck pain. I don't like taking opioids and pain meds. So I use a lot of NSAIDs. And some are prescription. I did not know that this interferes with blood pressure medication because they're both processed through your kidney and I can cause kidney failure. So those things, just like you said, no, look, research, AI, does this interfere with this? Will this interfere with this one? Is it okay to take an NSAID with this medication? So important. The other thing that I was really fortunate, and I think that every insurance company has, is I had a nurse case manager who would call and check up on me. And she knew everything. She took my whole story. She's like, okay, should we do home health? Should we do some speech therapy and physical? I came home in a wheelchair, so I was not able to walk. I was not able to walk.
Mhm.
Went to a walker, went to a cane, and I'm happy to say that I walk fine. But look into your insurance and see if there's a case manager because they're advocating for the insurance, obviously, to see are we doing things that are not necessary, and B, we care about you as the patient. Are we following a good care plan that's taking care of your needs? So I think that is another thing that's super important. And as we close up here, gosh, I could have made this a 2 hour segment, but what I want to do is I want you to be able to toot your horn and share with us your website, your book, your everything about you, how we find you. If I have any questions, how do I find Dana to ask her, hey, what should I do about this? This is your moment to shine. This is why I do what I do, to let you have that audience to bring to you to help them.
Well, thank you. Thank you, Maureen. I really appreciate it. My website on the work that I do is at thethinkingpatient.com. So you could find information about what I do for employers and healthcare organizations there. I post regularly on LinkedIn, Dana E. Sherwin. I post under my name, not under the Thinking Patient. I post under my name because I've been in the healthcare field a very long time and I have a large network of people in healthcare and have so expanded my reach to people who are so focused on health and wellness. So and also physicians and nurses and everybody really interested in helping people like lead healthier and better lives and make more efficient use of the healthcare system that we have and working towards improvement of that. So I post my focus is on helping people communicate with doctors and being more engaged in their care. And I select topics based on my own interest and my own experience. And I've been doing it every week for 2 years. And so there's really a whole library of information and topics from how to choose a doctor, how to use internet resources for healthcare research, about how medical students are trained, how AI can work to your advantage. And I pick a topic and I do research on it, and then I write about it, and I post it on LinkedIn. So there's a lot of information there for people to use. And I'm very proud to say that my own hematologist oncologist does follow me and like my articles on LinkedIn as well. That's one of the highest compliments possible, but she's terrific doctor and compassionate physician in a really difficult field of hematology oncology. And so I'm really proud of the relationship we've developed and how helpful she is to me and how encouraging she is to me. And that's also a testament to the large academic medical center that I get a lot of my care. And I'm out in the community talking on this subject, and I speak at conferences and speak to employer groups, and I speak to sort of community health and wellness organizations who are helping people go through, let's say, a cancer journey or other health issues. And it's interesting how it doesn't matter how old somebody is, but older people tend to be really, at the end of life, or even, when you're going in the third phase of one's life, how interested people are really in understanding how best to take care of their health, because it's really nothing that they teach you in school or in college, or do you have good role models who can teach you how to be an engaged patient? Nobody really talks about this. I mean, we talked about it at the beginning of this podcast, that it's a subject, though, that people will put so much effort into other areas of their lives because of their interests or their work, but this should really be just as important, to have the tools and the knowledge and the resources that help you stay healthy and help you really face a healthcare journey that is difficult to face, whether it's for you or a family member. But having the tools and knowledge, whether you work in the healthcare system or not, I think is really important to having, at the healthiest life that you can have.
Oh, I agree so much. What area are you in? Where do you live for our
Uh,
local?
I'm in New York.
Okay. Love New York. Oh gosh. Love New York. Would love to move there. Perfect, perfect, perfect. I love everything about what you do. And if there's one thing that I have learned, and maybe this is what my lesson was, like we talked about, what did I learn from all this? I used to say your mental health, as a mental health practitioner myself, your mental health will spill over in physical. Well, what I now learned is that my physical health overspilled into my mental health, and it was not good. And you cannot mindset away physical illness and pain. And I think that's really crucial. Yes, we can meditate to calm ourselves down, but I learned a lot about how crucial it is physically to take care of ourselves, like you said, do those yearlies. And yes, mental health is absolutely important, and we want to lower our cortisol levels and all that so we don't cause issues. But yeah, I learned a lot that this master life coach could not mindset away anything or meditate away anything. It just was there in the forefront of my mind. So, guys, I'm going to have all of her information in the show notes. So don't forget to go look her up. She's Dana E. Sherwin on LinkedIn. And then we're also going to have her at thethinkingpatient.com. So I'll have that information. It has been just an absolute joy, and I knew this was going to be everything that I thought it would be. You're just a plethora of needed knowledge in this area. We're all going to face medical issues at some point, whether it's a family member or ourselves, definitely ourselves. We need this information. We need to be better at helping ourselves. I think that's really it. We help ourselves. We knowledge is power, and it's empowering. I mean, empowering is what we really want to cue in on. So hang in with me, Dana. Thank you so much for being here. You just are an amazing person. I'm honored that you were here and you're a guest on our show today. Thank you. All
Thank you.
right, guys, that's going to wrap us up for this week's episode of I Never Knew, But My Dog Did podcast. As always, you know where to find me. I am at lifecoachmaureen.com. I also do speaking. I think I'm going to hit on a whole new area now relating to your mental versus your physical, because that's why I asked for it, apparently. So here I am on the other side of the mountain, and I'm getting better every day. Happy that I have my voice back. I think that's the hardest thing of my whole journey, was losing my voice, because my voice is me and it's what I do. And so, wow, the gratitude that I have for having that back is amazing. So, for any coaching, again, for self-confidence, for, just anything that you're going through in life, I'm there for you. And I want to help you move forward. I want you to be positive. I want you to be strong and empowered. And that's what I live for. It's what I do. So, Maureen, lifecoachmaureen.com. And then, of course, let's not forget my books. I did just publish another children's book. So I have two children's books. My dog Bexley is Just Like Me, which talks about self-care and that emotions are okay. And I just published My Cat Grayson Is Not Like Me. And this also embraces differences. It's okay that we're different, that we do things differently, but in the end, we can love and respect each other others for our differences. So it's a really fun and cute little book. And then, of course, my two other books. My dog is more enlightened than I am. My dog is my relationship coach, relating to your love relationships and also loving yourself. So all of those are on Amazon, and I appreciate good reviews and letting me know that you got something out of it. Last but not least, if you're in the local Austin area, my Dog is Everything Boutique. We have healthy doggy treats, lots of apparel, fun gifts for your dogs, toys, you name it. We have it, and we will be in Round Rock this weekend. And then next weekend, by the time we get this episode published, we'll be going, I believe we're in Cedar Park. So anyway, just look us up. Well, if you look me up, you'll see that on my Facebook whenever we have events. So thank you guys for being here. Thank you so much to Dana, and that we have people in this world, light workers like Dana and myself, who want to help you, who we care about, who we want you to be able to say, I'm going through this thing. Oh my gosh, they went through it, and that is so helpful, and it changed my life, because that's what I'm here for, to change lives. The Everybody knows my favorite thing is the starfish story. So if it mattered to one of you today, I'm happy. That's it. As long as I touched one life, because you're going to touch many, many lives. The ripple effect out there in the world. So thank you all. Take care of yourself. Take care of each other. Most of all, please take care of those furry babies and make sure that we adopt and do not shop. There's too many babies waiting for that forever home, and to love you unconditionally. So until next week, everybody, love you, and we'll talk to you soon. Mwah. Perfect. Hi. This was
Hello.
fantastic.
Uh,
Thank you.
you're a firecracker. You are a
Oh,
firecracker.